and I'm here for a week, and I've come over particularly for a diabetes conference between the UK and India, because it's one of many diseases that we have in common, and it's a very good example of how the United Kingdom can learn from India, and we can share our knowledge and our experience, both of us are in partnership together. So I've come today because I wanted to meet your Chief Minister, because we've already been doing some work with your state government, which has been very successful. So, for example, we've been looking at how to improve the quality for mothers and their maternity care, because obviously we've had a long history of public health paid for by the taxpayer, so it's free in the United Kingdom. And I know that in your 12th plan that you are looking at a similar system, and I know you have huge goals and huge aspirations. So we very much hope, but also we can learn from you, you can learn from us, and then we can work together with some of the people that we have who are experts in what we call primary care, which is when doctors and nurses work at a very, very local level, so that not so many people have to go into hospital. And also you can do a lot of work at detecting illnesses and diseases before somebody has to go to hospital, so in the early stages. And it's always, I think, better to go out into communities with healthcare than have to have people who have to travel in, which can be difficult, especially if you're not well. So we hope that India might take up some of the various companies and the businesses that can help to provide primary care. And as we've seen with Calypso, some of the other work that we've done, which is about regulation and how you make sure that you get the absolute best for your people. It's taken us a long time to achieve that, and we've got a lot more to do, which is why, frankly, on something like diabetes, we can learn a great deal from what you've been doing in India. So we were talking about the possibility of carrying on doing more of this sort of work, which is, it's something we call an institution called NICE, which is about quality and improving health treatments and health care. But also I and others were asking to see whether or not some of the pilots that we've done, based on some of the British experience in the British system, whether or not that could now be rolled out as part of your desire and your dream to provide a universal care system, healthcare system. So that's really what the talk was about. It was to see how we can work even better together in partnership.